Hey, everybody. Welcome to the Health Babes podcast. I'm your host, Dr. Becky Campbell with Dr. Crystal Hone. Today, we have an amazing guest on, Dr. Mamina. She's a triple board certified dermatologist, internist, and a dermatopathologist. So we talked about so many things. I get asked about Botox all the time, and I am not a specialist in Botox, but she is. So we asked her a lot about Botox, how it affects your health, the right way to do it, the wrong way to do it, the different types of Botox brands. We talked about lasers, microdermabrasion, the best skincare, whether it's from the drugstore or more expensive lines. We talked about the importance of sunscreen, acne scars, hair loss, you named it, we talked about it. So we are so excited to welcome her. We hope you love this episode. Hey, everybody, let's welcome Dr. Mamina to the show. We are so excited to have you. We're always stalking your Instagram. For you guys that don't follow her, you have to, because she has some really great information on there.
So detailed. I mean, you give so many options. That's what I love about it too. You know, from more cost-effective options to higher end, all the science. And I just appreciate your work so much.
Oh, thank you so much. Thank you.
Okay. The first thing I want to talk about is Botox. And I was talking to you off air a minute ago, and I was telling you, every time I put up a question box, I get at least 3 people asking me if Botox is safe. So number one, I don't do Botox. I have done Botox. It personally didn't look good on me. It made especially the side drop a lot. So I just was like, you know what? It's just not for me. I look weird, but I know for some people, they love it and they don't want to live without it. So I get asked a lot, is it safe? And I personally think it depends on the person, someone with maybe, chronic illness and they're having trouble in everyday life, probably not the best time to go get Botox. Right. But what I really want to know is, since you're the person who specializes in this type of stuff, I want to know your take on this.
Yes. And by the way, when you said that one side dropped and it didn't really look great on you, that's also practitioner dependent. So you might want to give it a second try too. And then there's also different brands and all that stuff. But in general, yes, Botox is safe. It's very, very rare for somebody to react to Botox. And I mean, I say it's safer than getting a vaccine. And, I think vaccines are important. So we see more issues and reactions to that. So it's pretty safe. The people that we say should be cautious with Botox. And when I say Botox, Botox is a brand for botulinum toxin. There's other brands out there like Dysport, Xeomin, Jeuveau. Now there's the new one, Daxxify, but we'll just say Botox for simplicity purposes. And so it's overall safe, but the population that we advise against it are people with like autoimmune muscular disorders, because Botox works by decreasing your muscles' ability to contract. And, we're just concerned that can interfere with somebody's muscular response if they're already having issues with that. There's a disorder called myasthenia gravis, very rare autoimmune condition. And then, yes, if you're dealing with a bunch of other chronic issues, probably better to probably have bigger fish to fry and focus on having your body heal itself without any other distractions.
Right. It's usually like the mast cell activation syndrome group that asks me, and I'm like, maybe not right now for you. Speaking of all the different brands, so there's a rumor that Xeomin is safer. And so what do you think about that? Like, are they kind of all the same? Do you prefer one over another? How do you choose?
Yeah, I think people think that Xeomin is safer because it's a smaller protein. So there's like less surface area for your immune system to react to it. Dysport, I would say, has the largest protein. And what I find interesting with Dysport is that it's still not common at all, but I do see people get a little bit more headaches after getting Dysport. So I wonder if it's related to like the larger protein size. Now, I love Dysport. I love the way that it looks on people because of its larger protein size. It actually has like a larger spreading effect. So it diffuses a little bit more. It can look more natural. But I think that's the thought process behind Xeomin. It's just like a smaller protein, so less potential reactivity to it.
Okay. What about when they say don't lay down after Botox? Is that true?
Yeah. So yeah, it's really the first few hours after you get injection where it's most important to not do anything crazy, move your to not exercise, to not be on one side versus the other. I think laying back is okay, but if you're like wanting to take a nap, there's a chance you could go on your side, and you just don't want to do that. You just don't want it to migrate to a surrounding muscle.
Do you think that it's a good, like, you know, how we hear a lot, people in their 20s should start doing preventative Botox? Is that a real thing? I mean, is that something you advise also, or no?
Yeah, it's not something I advise, but for people who are bothered by wrinkles in general, and they're already starting to see that they make pretty intense facial expressions, I think that it can definitely, make a positive impact and be easier for them later on to start a little bit early. But it's not something I condone. I mean, really anyone can get Botox. It's FDA approved for people who are 18 and older. So what I tell people is, it's a matter of how much your wrinkles bother you, how much you're afraid of wrinkles down the line, and how intense your current expressions are. So it's kind of person dependent.
Yeah.
And
what about like sorry, Crystal.
It's
what
okay.
about like Botox fatigue? I have a friend who's been getting Botox forever. And one of our common friends who's a cosmetic surgeon told her, he's like, you need to stop for a while. You're like, you can't, your body can't do it anymore. Like it can't pick it up anymore.
There's a couple of thought processes behind that. So one, with some people, depending on your immune system, some people can become like immune to Botox over time if you do it frequently and often. So that's one aspect. Once again, person dependent. People can do, I have patients who've done Botox since it first came out in like the 90s, and they're fine. But some people can be sensitive, or their immune system can react and like build antibodies to it. And then there's also people who've done it for a long time to the point where like their muscles are so atrophied that it's like not even really going to be beneficial to keep doing it, because then it could just like look weird too. So, and then that's once again person dependent. Like it's just like how muscular their muscles are. So yeah.
Sometimes I notice when I'm watching, like I was watching What Happens Live, I think it's called, with Andy Cohen, and he always has some of the housewives on there.
Yeah.
They get real frozen, a lot of them do. And they're, I feel like some of them 60s, 70s trying to stay looking 20 anyway. And I won't name who, but I noticed, and I've seen this on other people too. It was like almost like the eye, almost like strabismus was like kind of happening because, and I'm assuming it was the Botox related, just like for doing it for so long and doing so much. And I've seen this on someone else, that's another celebrity, like she turned her head and then her eye took a second to kind of catch up. And I know both people that I saw that with had a ton of Botox. And I just wonder if it was just like the placement of it.
Yes.
Yeah.
A lot of it's the placement. So sometimes you have to be very careful around the eyes. It's so rare, but if it's placed, and everyone's anatomy is different. Once again, it's person dependent, but if it is, there's a tiny chance that it can migrate to a deeper eye movement muscle, which is like further back. I mean, really, you're supposed to inject very superficially if you're doing the crow's feet. So it could be injector related and patient related.
Yeah, so go to a good injector.
Yes.
The story.
Yes, but yes, the frozen look is just, gosh, I know some people want that, but I feel like there's a movement towards, wanting to look more natural,
for
kind
sure,
of underdoing than overdoing. The goal is to look like you haven't had Botox.
Yeah.
Or Dysport, you want to be able to make normal expressions. You just want to feel refreshed. And look not stressed out.
I keep seeing memes, and it's like a girl who's 20, and it's like she looks like she's 40 trying to look 20 because of like the overuse of the injectables. So
totally. Yeah. And then with fillers, that's where it starts to become a slippery slope. Yeah.
Yeah. Do you do filler too?
I inject filler in patients. Yes.
Okay.
But I'm very cautious with lips because that's where I find that it can be pretty like obvious if you've had filler or work done, the lips, there's not much volume in the lips to begin with. So yeah, you have to be very careful with how much you put in there because
as with anything, right?
As with anything.
Yeah. Well, I appreciate you being so candid about that. And it's true. Everybody has to do what they feel comfortable with, but we get so many questions about Botox and the safety and things like that. So let's get into, some other things that we get questions about that are hot online and all these things, especially with retinols and retinoids. We hear so much about those. Can you kind of talk about the differences between the two? Sure. And break that down a little bit? Because I know tretinoin's like a hot thing all over the internet too. So
oh my gosh. Yes. Because it is considered to be like the number one anti-aging ingredient after sunscreen. Yeah. But yes, there's so many retin words out there: retinols, retinoids, retinoic acid, retinaldehyde, and it can get kind of confusing. But I would just look at the word retinoid as the overarching umbrella term for all of these words. And so retinoids are considered to be a vitamin A derivative, and they work by going first on the surface level of your skin by increasing your skin cell turnover, which helps kind of give you more of like a renewed look, resurfaces the skin. It helps unclog pores. So that's how it plays a role with treating acne. And then it also goes deeper in the collagen to remodel collagen. And that's how it helps with fine lines and wrinkles. So in terms of the differences, a lot of people have heard of retinol. So retinols are available over the counter. They're not the active form of a retinoid. Retinols have to get converted to something called retinaldehyde or retinal, and that's also available over the counter. So it's slightly more potent. And then retinaldehyde has to get converted to retinoic acid. Retinoic acid is the active form of a retinoid, and that's what tretinoin is. And tretinoin has different analogs or cousins like adapalene, as well as tazarotene or Tazorac. So those are all prescription. Adapalene became over the counter a few years ago, but those are the active forms. So that's why people may notice a little bit more irritation. They can work more quickly, but with the prescription strength, that's the active form. Retinol is probably the most common because that's what's most widely available over the counter. And we're seeing, actually, there's a lot of great retinols out there. You just have to be more patient with them because they have to convert to the active form. So it may take a little bit longer to see the benefits.
And for those that don't really know like what they can see with a retinol, what are some benefits of that for people?
Yes. So with retinol, sometimes people may notice, so, especially if you have sensitive skin or dry skin, but really any skin type can notice some peeling initially because that is increasing your skin cell turnover. And with that, it can help with like uneven skin tone. So it can brighten your skin. It can help with hyperpigmentation. And then it can help with like, post-inflammatory acne marks. Retinol can maybe help a little bit with acne. We see more benefit with the active form, the retinoic, like tretinoin. And then of course it works deeper in the collagen. It has to get converted to the active form, but once it's converted to the active form, it can help remodel collagen, and that's how it helps with fine lines and wrinkles. So overall anti-aging, smoother skin, like it does all the things we love.
Yeah. What were you going to say, Beck?
I was going to ask, do you use tretinoin?
When I'm not pregnant, I'm currently 35 weeks pregnant.
I saw that.
Yeah. You're almost there, girl.
I'm almost there. Thank you. But yes, when I'm not pregnant, I use tretinoin. But I also, I like to learn a lot about other retinols out there, and there's a lot of really good ones too. So I mix it up a lot. I dabble, which is probably not good because to see the benefits of something, you want to really use something consistently. I would say for at least 6 to 8 weeks when it comes to retinoids. But I'm definitely a big tretinoin fan.
Awesome. I hope you guys are watching this on YouTube because you have the most beautiful skin. You're like glowing. It's insane.
Thank you.
I'm just like,
and it's not just with pregnancy, like all your videos, you're beautiful.
Oh, thank you. Pregnancy is helping. I do have to say, but thank you.
Yes.
What about pore size? I think, you see things claimed to make your pores smaller, and that's my biggest thing. I have a little bit of a filter on, so my pores look nicer right now, but they definitely are the thing that I would say I hate about my skin. And from my understanding, you can't really shrink pores, but you can keep them cleaned out, right? And then that helps them not to expand. And
yes, I think that there are two aspects to enlarged pores. One is what you said, is that they're full of full of material. So usually oil or sebum and dead skin cells, also known as keratin. And so using products to help kind of clear out those contents is going to be helpful. And we could talk about those. The other aspect of enlarged pores is if you've had these contents filling your pores for years, like starting since you were a teen and you hadn't done anything about it, those pores can be scarred and like stay open. So even if you're using all these products to get rid of the keratin and the excess sebum, you could still have enlarged looking pores. And at that point, you're going to have to take more aggressive measures and treat it almost like you're treating like acne scars, because these are a form of scars. So that's where procedures like lasers, chemical peels, microneedling can play a role. But in terms of emptying out the contents, like if you just have like clogged pores, you want to use things that help pull the oil out. Salicylic acids have a high affinity to oil. So that's why we recommend salicylic acid toners or washes. And then retinoids increase your skin cell turnover. So people who are prone to clogged pores, there's something about their keratin that's just more sticky than the average person. So they need a little extra help to kind of clear out that buildup of keratin. So that's where retinols or retinoids can play a role. And then glycolic acid as well can help. And then in terms of the collagen remodeling, glycolic acid and retinoids can help kind of rebuild the structure integrity of the pore wall to help it from expanding further.
Yeah.
Okay. Yeah. I use those Skin Better pads.
I love Skin Better.
That's what I saw you did. And I was like, oh, yeah, she likes Skin Better. So
I'm a Skin Better fan, but yeah, those pads are fantastic. They have
are.
Like a bunch of goodies in them.
I alternate those with, I think it's their retinol cream.
Yeah, their Alpha Ret. That's
Alpha Ret.
That's their famous product. Yeah. That one has actually been shown, their Alpha Ret's been shown to be comparable to tretinoin 0.025%.
Oh, wow. I got to get better with that. I don't use it as much as I should, but I love that line.
It's great.
I mean, information overload too, where we're like, oh my goodness, what's the best? What do you know what I mean?
There's so much out there.
And they're clean. They're a clean brand.
They are. Yep. They're like paraben free, and they're very cautious or like mindful about what ingredients they use.
Yeah.
Which is so nice. Yeah. And we appreciate that.
Listen, guys, we get it. Not everyone has the time, money, or the capability to commit to finding and working with a functional medicine doctor. And guess what? That's okay. You can improve your health and you can alleviate your symptoms in a different way, a much more convenient way. So head over to healthbabes.com/courses and check out our functional medicine at home programs. In those programs, you'll get everything you need to start thriving, feeling, and looking your best today. If you use the code HealthBabes50, you'll save $50 off the course. And this promotion is exclusively for our podcast peeps.
So how important is vitamin C? You talk a lot about that. And what should we be looking at in our products specifically with vitamin C? Like what? Yeah, like ingredients.
So in terms of the importance, I would say that's third place. So sunscreen, retinoids, and then vitamin C. Cool. And vitamin C does a lot of similar things that retinoids can do. It goes deeper into the collagen to help with collagen remodeling. So it can help with wrinkles. And then it also, as an antioxidant, it works with your, it actually works with your DNA essentially in your skin cells to help protect your skin cells from UV light, pollution, like the daily aggressors or stressors that our skin is exposed to. And then that can also, it also works too with hyperpigmentation. The antioxidant properties help with that, with the melanocytes, the cells that produce pigment.
Yeah.
And Yeah, with vitamin C, I would say if you had to splurge on anything, it would be vitamin C because it's a very delicate molecule, and its potency can be affected pretty easily if it's not like good quality, or it's not packaged well, or if it's not a good quality vitamin C. And then like the two forms of vitamin C I like are L-ascorbic acid, and then to look between like a 10 to 20% L-ascorbic acid. And then the other one I like is THD ascorbate. It's like, I can never remember. It's like tetrahexyl ascorbate or something. That's what Skin Better uses, and Revision. I love both of their vitamin C's, the Skin Better Alto Advanced and the Revision C Plus Correcting Complex. But then SkinCeuticals, they're like the OG. Their CE Ferulic has the 15% L-ascorbic acid. But then there's some good drugstore ones as well, and like Sephora level vitamin C's too.
Yeah. And for those of you listening, she has amazing reels where she shows, some more cost effective to higher end, which we appreciate, right? Because everybody has different financials and all the things. So definitely go to her page, you guys, if you're listening, and she has all these different types and products and stuff. It's great.
Yeah. Thanks for the shout out there.
Oh,
yeah, no, you could still have good skin on a budget.
Yeah,
for sure.
So there's a trend that's been going around that not to wear sunscreen.
Yeah.
How do you feel about that?
I was actually going to make a video about it because I'm like really fascinated by why there's like so much like hatred for sunscreen and why people think sunscreen causes cancer. And I have like a few ideas as to how all of this has started. So I mean, there's a lot. So one is people like confuse correlation with causation. They think, oh, with the rise of sunscreen use, there's been a rise of skin cancers. But just because there's this correlation does not mean the use of sunscreen has caused skin cancers. There's
so many other factors, right?
So many other factors that have played a role. And I'm obviously like, I'm of the mindset that there's more than just there's more to creating skin cancer than just being exposed to the sun. It also related to our overall health, the strength of our immune system. So I can understand like where people are coming from. They're like, oh no, it's because we're all eating processed foods. Sure. But there's multiple factors that are at play here. But anyway, so some people just, because there's more skin cancer, they just think, oh, it's because of more sunscreen use. So that's false. We 100% know, like epidemiological studies have shown, and there's not that many that really show like 100% causation, but we know that the sun causes UV damage to your DNA, and that causes skin cancer. We know there's a correlation. Sun is a form of radiation. So it's just a matter of like, how do we play with the sun in a safe and good manner. So anyways, so that's one. The other one is that, a couple years ago, there was that scare where they saw benzene, which is a contaminant in a number of sunscreens. I think it was around 70 or so. Scary. Benzene is not a sunscreen ingredient. Benzene is found in so much of our environment. It's found in like car exhaust. There's like higher amounts at the gas station. And benzene, I don't know the science behind how it became a contaminant, but it was found in a number of sunscreens. It was interesting, more so like the aerosol sunscreens. And benzene has been associated with leukemia. What's interesting is that the amount in these sunscreens is so low, so we don't even know if there's a correlation or if this is even going to cause leukemia down the line. There's so many other ways to get higher exposure to benzene with like pollution in our environment. But anyways, that I think scared people. And I think when they heard that, that benzene can cause cancer, the automatic thing was, oh, sunscreen causes cancer. So I think there was that. And I think that a number of those have been recalled, but gosh, that gave sunscreen such a bad name. So
is there a sunscreen you like?
There's a ton that I like. I'm a big fan of the Elta MD line. All of their sunscreens have zinc in them. Some of them are like zinc only. Some of them are hybrid zinc and chemical sunscreens. I was going to say the other thing is that there have been reports about certain chemical sunscreens like oxybenzone having like endocrine disrupting issues. Oxybenzone is now not being used in sunscreens, but I could see how that causes people to lose faith in like the whole skincare sunscreen industry. Cause it's like, okay, what about these other chemicals? Like, how do we know that those aren't causing other issues? Because there are small studies with some chemicals that are still being used in sunscreens, but not enough for professionals to say that it's bad. But anyways, I'm a little bit more cautious with chemical sunscreens personally, because we know that it also can enter the bloodstream, and being pregnant, we don't know like what it can do to the fetus. So I'm just like, if you want to play it safe, then I would just say use mineral-based sunscreens. And you don't have to, but I would say if you're going to be outside, still wear sunscreen, just a mineral-based sunscreen. So yes, I'm a fan of Elta MD. I'm a big fan of La Roche-Posay. They have great technology with their sunscreens. And I like for like long days at the beach, or like if you're going to spend time outdoors. I try not to spend long days at the beach, but like Blue Lizard is another great brand. Neutrogena makes really good mineral-based sunscreens. And gosh, CeraVe too. My husband's chiming in.
That's cute.
Yes. But yeah, those are some of my top brands.
Yeah, Skin Better has like a compact.
I love the Skin Better, and then their, I forget the tone. It's like even tone, or
the even tone serum. I use that.
The even tone serum is good, but their sunscreen, I forget what it's called, Tone Smart or something.
Okay.
That one's awesome.
Okay. Sam, I'm taking notes. I'm like, well, I didn't know about that.
I really like Clear Stems. They've been really good too, because I have to be careful because some of them break my face out, but I'm always, but that's good for me. And it's a mineral based.
Oh, awesome. I've been, Color Science is also another fantastic brand. They have a new one that's non-tinted that looks clear. I'm like, this is amazing. A lot of people have problems with the white cast, but then there's people who don't want to use tinted because especially like men, they're like, it feels like makeup. And sometimes tinted can be messy. Like because you're supposed to put sunscreen not only on your face, but like your neck, your ears, the tops of your hands. Tinted, it gets messy.
It does.
So I do a double layer. I do like one layer of non-tinted and then a layer of tinted just for the face, but I do the non-tinted like all over.
Yeah, there's a lot of skin cancer on the ears, isn't there?
Oh my gosh.
So many people get it because you never think to put the sunscreen there.
Yep. Yeah. And people will wear like baseball caps, which don't protect the ears. And then we also see a lot on the nose too, protruding parts.
Right, for sure. That catch the rays easily. So we're going to pivot a little bit. A lot of our patients that we've worked with, and we work so much with hormones, hormonal imbalance, infections in the gut, all the things where we can see a lot of acne, right?
Oh, yes.
So acne scars, what are some of the best treatments, like even products and, the different other treatments that you have found to be very beneficial, especially for the deep scarring? It's traumatic for patients who struggle with that.
Oh my gosh. Yeah, it definitely can make a huge impact on mental health, especially the deep kind of indented scars. So the approach for indented scars is a little bit different than just like discoloration from acne scars. Indented scars definitely take a lot more work. That's why we say don't pop your pimples.
Yeah.
Because all the inflammation will like break down that collagen and then cause those indentations. Intense acne alone can also just cause indented scars. You don't necessarily have to pop your pimples to get those scars. But for those indented scars, you have to do things to really help kind of build that collagen. There was an interesting study that showed like the top 3 best methods to get rid of indented scars. And the number 1 was something called subcision, which is like you're taking it's like a special type of needle, but I just use like a regular needle that's a larger bore size, and you go under the scar, and I numb the skin first, like I'll inject lidocaine, but you'll go under like each individual scar and like break up the scar tissue that's like pulling or tethering that scar down. That's why there's that indentation. So you're kind of breaking it up so that it kind of releases it and like can help bring it up to the surface. So that's one way that can get pretty tedious. And I usually tell people it takes a village. It's not just going to be one thing.
Yeah.
And then like pretty intense lasers, like CO2 lasers that can really also get deeper into the collagen, heat the collagen, remodel the collagen, and really strong chemical peels there's a type of chemical peel called TCA cross, trichloroacetic acid. And I don't know what the purpose of that word is, but anyways, it's a high concentration of chemical peels. And those are really good for like those ice pick scars where just like little tiny dots that are indented, and like dipping like a toothpick like in this high concentration of chemical peels and like dabbing each scar, where each scar really gets the benefits of the chemicals. But then I also am a fan of microneedling. That could be helpful for like not as bad scars. And then microneedling with PRP, platelet rich plasma, just give a little extra boost there. Like
I love the Morpheus, not to cut you off.
I love Morpheus.
That thing is the jam.
That's radio frequency with microneedling. So it's like microneedling taken to the next level. Like radio frequency is also being emitted as the needle is in the collagen to like further stimulate the collagen. Yeah, that stuff's great. People complain that it hurts, but I think it's
Crystal,
beauty is pain, right? Beauty is pain. You gotta go through it. It's so worth it. I feel like your products absorb better, like because I don't do Botox or like filler or anything, to each their own, right? So I love the Morpheus. I mean, for my forehead 11s, for my
I think it's great.
40, so
yeah, I think it's a great tool if people want to like try to postpone filler as much as possible to like do radio frequency microneedling.
It's great. Yeah.
But speaking of postponing filler, can filler stretch your skin out? So like a lot of people are doing like jawline, chin stuff. Can that make that, because my biggest thing now is my neck skin is like, seriously, Crystal, and I tell Crystal, I'm like, I have a fanny pack that I'm wearing around my head, and I can like hold snacks in there.
Well, that's more of like a skin. Well, it depends on what it's that is more of like either increased fat or increased skin laxity.
Mine's the skin laxity. It's just loose. Okay. It's like this wonderful genetic gift I've been given.
Oh yeah, it's totally genetic for sure. Yeah, and that's where like more like skin tightening procedures play a role.
Yeah.
But in terms of filler increasing volume, I feel like that's a little bit of a controversial subject, because I think it's possible if like and it doesn't happen with everyone, but if you use like too much filler, some people's skin is like just how some people are more prone to stretch marks versus other people. It's like some people may react more to volume being in their face, like their skin will stretch and be like that. Some people can just bounce back.
Exactly.
So I think it's person dependent, but I think it's still kind of rare for something like that to happen. And you might have to have a lot of filler too for something.
Yeah. Like and that's when you see people start looking strange. I think filler, when they go wrong, when they start making their cheeks real big and stuff, like Courtney Cox, she was so beautiful. And I'm only naming her because she talks about it, she was so beautiful. And it's like, I try to examine what happened and I really can't figure it out. I'm assuming it was filler, right?
Yes, I'm pretty sure it was filler. Yeah, it's a combination of filler and like a little bit of people's perceptions like can be altered as well. And like some people become addicted to some of these things and don't realize like what their face is turning into.
Yeah. They don't see it, right? They don't see what they look like. Yeah. Because it can look great. I mean, I've seen some filler really help change some asymmetries and stuff in people, and it looks great. It's just about how far you go, I think, with everything. So yes.
Like I will turn patients away if they want more, and I don't think they need more. And I think
it's good. It's have to have a healthy balance with that.
Exactly.
There she goes. Crystal says balance, and I just love my
accent.
Wait, where are you from? Wait,
Michigan.
Okay, yes. Balance.
I did the CO2 laser years ago, and I looked like a raw steak, but it was awesome. I mean, it took all the brown spots off. It was amazing.
Phenomenal.
Yeah. I was gonna say both of y'all have great skin.
Oh, thank you so much. Yeah, we work a little bit hard at it, right?
I'm seriously, I've done like every laser. I do microneedling. I just started peels. It's not easy.
It's
I
fun
know it's
dabbling.
fun, but yes, it gets expensive and like intrusive, like, cause there's downtime too for some of these things.
Yeah.
And we do a podcast. I'm like, sorry, Crystal, I can't record for 2 weeks. I look like a peeling snake.
Exactly.
I'm like, oh, it's okay. They love us anyway. We'll just get on here.
Yes.
What about red light therapy? Sorry, Crystal. What do you think about red light therapy?
Yes, I am a fan of red light therapy. I think that, there's so many now that are available just over the counter. The issue is just knowing which one's better than others. And I honestly don't know, like, because I feel like they're so different and they haven't done good studies. I think that the ones that are more expensive are probably more effective, like the Saluma, like the ones that they probably carry in more of the professional settings. But I am a fan of Saluma, and then another one called Lumibox. But yeah, I mean, I've had companies send me a variety of things and they all seem fine. I don't think it's not going to be as intense as, other in-office procedures, and you have to be patient. If you're using it at home, you have to be very consistent, use it for weeks, months. But I think it's like a nice non-invasive way to improve and rejuvenate your skin. It works on the collagen level to help remodel collagen. I would be cautious if you're prone to melasma or hyperpigmentation. Just make sure that you feel like it's not heating up your skin, just because heat can increase hyperpigmentation or melasma.
That's good to know. I have it at red light therapy in my sauna.
Oh,
so that's awesome. How I do it. But it's not really on my face. It's kind of sideways.
It's for
the back. But it's nice.
Inflammation, but you're talking skin purposes, right? You just can't take time.
Yes. I think like the deeper, like the infrared light can help more with like deeper tissues and also be anti-inflammatory, but regular red light's also anti-inflammatory.
Yeah. Great. Looking for more freebies and resources, head over to healthbabes.com to get your free liver support guide. We all know and are learning that supporting your liver is so important for so many things when it comes to health. It's a master regulator, metabolizer, detoxifier. Supporting the body's natural detox pathways is important for overall health and well-being. And that's one thing that me and Beck have found out working with so many patients throughout the years. Once you really start working on your detox pathways, you start to see a lot of things unfold and other things start to get better, right? And so over at healthbabes.com, you can also find a full list of our favorite trusted food, beauty, and health products. Use HealthBabes50 code at checkout for any of our popular at-home health courses. Again, you can find our free liver guide and health courses at healthbabes.com. So we see a lot of people too. We've made a list of questions here for it because we wanted to hit a lot. Stretch marks is a big issue, especially in pregnancy. What are some things that people can do to help that? And I know some of that is genetic too, so we see that a lot. What can women do?
Well, if you're pregnant, it's definitely a lot more limited because the best treatments are really the ones that you shouldn't be using while you're pregnant. But I think that, so as a pregnant person, try to think of what I'm doing. So really, I think the simple act of massaging really anything, I think is doing something for sure. So it could just be a moisturizer, but just the act of like massaging and nourishing, moisturizing your belly is, I think, really helpful. So the thing with stretch marks occurs because the collagen is essentially like ripping. So you want to do things to make your collagen strong. So things that are like pregnancy safe are like vitamin C, peptides, and, vitamin C, there's not a lot of like vitamin C things for the body. So that's harder to do because they come in such small, like little serum bottles, but I feel very lucky because I get a lot of skincare. So I could use like a bottle of vitamin C on my belly. And then same with peptides. A lot of them are just like in moisturizers, small things, catered for the face, small little serum bottles. But there's one, Alastin's a great brand, and Alastin has awesome peptides. Yay. Oh yeah. Yeah. The Skin Nectar is amazing. So that one you could use.
Crystal's holding up her bottle.
Yes. That one's awesome for post-procedure as well, but that's great, I think, for stretch mark prevention. Alastin also has a body cream. I think it's like their body treatment with trihex technology. That one is something that I do recommend if you want to prevent stretch marks. I think it's catered more for like crepey skin, but I think it's just their peptides are awesome and can be collagen and elastin building. And then there was some research that shows that hyaluronic acid itself, I mean, it almost provides like a cushion for the collagen. So that's something that could be helpful. And you have to get, not all hyaluronic acids are created equal. Some are like really large molecules that can't even penetrate the top layer of skin. So you want to look for one that have like smaller molecules. And then what else while you're pregnant? You know, a lot of people are fans of like different oils, jojoba oil, like sunflower seed oil. I think these are just like really nourishing and moisturizing. And I think just massaging with the oil is helpful. Now, if you're not pregnant, I would definitely recommend using a retinoid, like prescription strength, like tretinoin, just because we know that's pretty strong, both at helping with the collagen, but also like helping resurface like the appearance of those lines. And then procedures, kind of similar procedures that we've talked about.
Yeah.
Like microneedling, radiofrequency with microneedling.
Yeah.
Lasers. Yeah. Mm-hmm.
It's amazing. The Morpheus, I feel, has been such a big bang for my buck, I feel, and family members too, you know, especially I had even some cousins do it on their stretch marks and saw huge differences after a couple of treatments, right?
It takes time.
Yeah.
And it's not like, sometimes just one thing isn't going to take care of it. A lot of things you kind of have to hit it from multiple angles.
Yeah. Yeah.
What about, we get asked a lot about hair loss. And I saw that you talk about hair loss. So what do you do when someone comes to you with hair loss?
Yeah, I'm very passionate about it because I've dealt with it personally, like just through very stressful times that I had when I was in residency and I was dealing with like thyroid issues and all this.
Yeah.
So when someone comes in with hair loss, I take a thorough history. I find out, family history, how long the hair loss has been going on, what medications they're taking, what stressful events have occurred in their life in the last year, or in relation to when the hair loss started. And then of course I examine their hair loss pattern, if it's like diffuse or if it's like focused more on the top. So yeah, just doing like a really thorough history and exam. And then I do like to order laboratory tests unless it's like super obvious what the reason is behind their hair loss. But then I'll order some lab tests. There's certain things that have been more correlated with hair loss, like so I'll do an iron panel. I also check vitamin D. I'll do like a thorough thyroid screening, like, in addition to the TSH, I'll check the antibodies and other circulating hormones.
We love that. That's so good. That's what we do with everyone. It's
something that most doctors don't do, right?
They don't.
No,
People will say, I'm like, have you had your iron checked? Even if they know their thyroid's off, right? Because that's a little bit, I'm like, no, I've never had my iron. And I'm like, okay.
Some of the first steps. Yeah.
Yes.
Yeah.
If they have like
especially, I'm sorry. I was just going to say, especially the fact that you check not only the thyroid, like TSH, but you're checking the antibodies, because so many doctors aren't doing that either. And it's being missed so much.
Oh my gosh. It's so frustrating because in med school, they don't teach you how to how to optimize thyroid health at all. They just wait till your thyroid is like in the dumps. And that's like, okay, now we can give you medicine for it.
Yeah.
Right. Like your thyroid could be screaming for help. It's on fire. It's inflamed, full of antibodies. You're like, we can't really do anything. Right. So, but I try to like point people to resources. I'm not like a thyroid expert, but because I've had thyroid issues, I'm like super passionate about, like, I've done a lot of deep dives into it. And I'm also into the root causes. I mean, and then also I'm also board certified in internal medicine. So I've have experience treating thyroid stuff, but from the conventional side. And
exactly. Yeah.
But when people have positive antibodies, but still normal thyroid function and normal TSH, I really try to point them to resources, of ways that they can address the Hashimoto's before it actually, because sometimes I think it's like a heralding sign. The hair loss is a heralding sign before like their thyroid, really
Right.
stops functioning. So, yeah. And, we talk about diet things, supplements that could potentially help with Hashimoto's, stuff like
Gut
that.
health,
But gut health. Yeah.
Yeah.
And I need to like incorporate other practitioners who are more versed in that too. So yes. And then, so thyroid's huge.
Yeah. So you're running lab work for hair loss, a little bit of lab work. Okay.
And then, if they have like really obvious, if they're like a young female and they have like really intense balding, I will check also like their DHEA, testosterone, like free and total testosterone, those types of things. And then, and then there's certain, crazy forms of hair loss, autoimmune hair loss, like lupus. There's something called lichen planopilaris, or scarring alopecia, something called CCCA, centrifugal cicatricial alopecia. When people have crazy patterns of hair loss, I may do a biopsy for that. Alopecia areata is pretty obvious to diagnose clinically. That's where you get like the little circles of hair loss that are not scarring. So I usually don't do blood work for that. But so it's person dependent, but most common form of hair loss is just people shedding like crazy. We saw a lot related to COVID, like people having
stress induced.
Yeah.
Do you use any type of topicals or anything?
I actually will use a prescription that's a combination of, it depends on the hair loss, but it's a higher strength of minoxidil than what you can get over the counter. So over the counter is 5% at the most, but this, you can compound it to 6 or 7%. And then depending on if they're male or female or of childbearing age, I'll also add in like topical spironolactone for females, topical finasteride for men, or postmenopausal women, as well as tretinoin. So tretinoin can open up the hair follicles and allow the other medicines to penetrate the hair follicle more effectively. And it can also help a little bit with hair growth too, which is interesting.
That's great.
So I use like a compound. And then some certain shampoos like ketoconazole shampoo, which ketoconazole is an anti-yeast shampoo, but it's interesting. It can help with androgenetic alopecia, or male pattern or female pattern hair loss. There's like the 1% over the counter, but I usually will do like a 2% prescription, because it's it's been found to work on like hormone receptors on the scalp too, to help with hair loss. And a lot of hair loss is also associated with like people who have dandruff or like inflammation on their scalp. So the ketoconazole shampoo addresses that too.
Yeah, because a lot of dandruff is yeast related, right?
Yes, totally. Yes.
And the seborrheic dermatitis, pretty much same thing. But I know a lot of people, they'll have like flaking, and then hair will come out with the flaking too. We see that a lot with, I work a lot with histamine intolerant, and I see a lot of just dermatitis in general because of all the mast cells in the skin. But so I have a lot of people who one of their biggest complaints is their scalp is flaky, and it's, we do like all the underlying stuff to help calm down the mast cells, get the inflammation down. But then also I do know yeast can play a really big role.
Yeah. It like the body is producing like a almost inflammatory oil like in the scalp, and like to the yeast it's like delicious, so like they just like thrive on that oil. I see cases flare like when people are like, when it's close to exams, they're stressed out, they're producing more of this kind of oil. When people are going on like these drinking binges, you know what I mean? We see a lot of that too.
Well, the alcohol is really high in histamine too. For me, when I was really struggling with it, that was like my biggest trigger. Any high histamine food would make my scalp so flaky and itchy. And then if I stopped, doing that, this is before I knew how to like dig in and really find the cause, but even just reducing the high histamine foods really helped. But alcohol was like every time I would have alcohol, I would see it in my scalp.
Wow. Yeah, that makes sense.
Super fun.
I know. So crazy, the things that we see, right? Working with so many people. And it's been a learning process too, right? We've learned so much. They teach us too, right? And it's amazing. What about dermaplaning? We did that whole thing of, is my hair is going to turn dark if I shave my face? Like, can you kind of talk about that and the myths with that?
Yes, dermaplaning does not make your hair grow back thicker, if people are
Okay.
wondering.
Or darker, right?
Or darker. Yeah,
Okay.
yeah. But yeah, I think dermaplaning is a nice procedure. I don't recommend the setting where I don't recommend it is if you have any kind of inflammation on your skin, like active acne, rosacea, eczema. Otherwise it does help get rid of like some of that excess dead skin and allow other products to work better on your skin.
And the peach fuzz. I was also blessed with
Yes.
a good amount of peach fuzz on my face.
Oh,
I
yes.
love.
Yes, yes.
It's just so satisfying when you just sit in the mirror and you
Mhm.
see all the hair fall.
I know. It is.
Watching your videos too with like the procedures you do, I'm like, oh, that's so satisfying.
Oh, I know. I do feel very lucky being a dermatologist. It's interesting because it's really not the main thing I do. I mean, most of the things I deal with are like, acne, eczema, psoriasis, skin cancer, hair loss, and then like, some cosmetic. But it's always like when I'm doing like the full body skin checks and they're like, oh, can you help me with that blackhead or or what's this thing in my armpit? Like, can you help me get rid of it? It's like an ingrown hair. And I'm like, sure. Yeah, let's do it.
See, I wouldn't be able to eat for a week. I am so sensitive. I cannot, like, Dr. Pimple Popper would be torture for me to have to watch. I'm so like, ugh.
It's so interesting. It's such a like a divided acquired taste. Like it can, people hate it or love it.
The big I'm like this, and I'm like, oh, and then you warm up to it a little bit, but I feel
you find some weird things in some people's whatever you want to call it, like appears to be a pimple or whatever. But I've heard some stories, but I'm just like, you know what? I'll take your word on that. I'm not going to watch that.
Yeah.
Okay, so if you could pick one thing, like when it comes to taking care of your skin that you couldn't live without, what would it be?
Yeah, I would say, even though it doesn't sound fun or sexy, but I would say sunscreen.
I had a feeling you would say that.
And if it had to be like one thing, that I would just make sure it's like a sunscreen that has other, other ingredients, other fun goodies in it, other antioxidants, peptides and whatnot in it too.
Awesome.
Yeah. I had melanoma in two places.
Really?
I had it on my arm and on my leg. And I never wore sunscreen on my body. I mean, I wore baby oil, and I live in Florida and I would go sit at the beach all day when I was a teenager.
Yeah.
But especially after having the laser, I always wear sunscreen on my face. Always.
It's just crazy. Like I'm just so much more motivated after being a dermatologist because you see like differences, first of all, like even in one person, like their stomach versus their leg, just the difference in their skin quality, their legs that see a lot more sun, but also just all the skin cancer. And just so many people telling me like how much they regret being out in the sun and like they wish they could address like all these sunspots on their arms and forearms. Like when I drive, I wear like a very lightweight UV hoodie. I have one from like Uniqlo that like covers your hand, like it has like a hole in for the thumb. Like I wear that because I just get complaints every day about sunspots on the hands and forearms.
Oh,
to me it's easier than putting on sunscreen on my forearms actually. So like I do that when I drive.
Well, it's a good idea too, because you're not putting anything on your skin, you're just covering it.
It's easy. Easy.
I mean, take it from someone growing up in Florida. I have sunspots all over my body. And I'm like, can I do that CO2 laser everywhere? But
I know.
Take a back.
I know. It's tough because it gets annoying and expensive too.
Yeah.
To address things later on in life.
Yeah.
That's true.
I've done also too, Dr. Mamina, the IPL Lumeka laser. I've really liked that too.
Okay. Oh, I haven't heard of that brand, Lumeka, but IPL is a good, like overall, like nice, refreshing laser.
Good for spot, like brown and red. And
they just
brown
fell
and
off
red.
my face. I was like, this is great.
Yeah.
And it's not that expensive, like compared to some of the other ones. It's definitely more cost effective.
Yes.
Yeah. After getting the CO2 though, I feel like nothing.
Oh yeah.
I'm like, well, that didn't do anything. Well, it's because I had my whole face peeled off already.
Yep. The CO2 is super intense. Yes.
Gosh. Well, we appreciate you coming on so much. This was so fun. We had so many questions, and I know we took you all over.
I love it. This is dermatology though. Dermatology like covers like so many different things, which is why I love this field. It's all over the place.
It's so interesting. I mean, I could ask you 100 more questions.
We could be for hours.
Well, would love to talk again too.
Yeah, we'll have a part 2.
Yes. Yes.
Well, thank you so much for coming on. You're amazing.
Oh my gosh. Thank you so much for thinking about me and having me on here. Really enjoyed it.
Well, thanks everyone for listening.
We hope you guys enjoyed this episode. If you did, if you can pop over and leave a review, that would be awesome. You can also find us over at healthbabes.com, where you can find our courses, our latest book. We also are on Instagram at The Health Babes, at Dr. Becky Campbell, or at Dr. Crystal Hone. I hope you guys have a great rest of your day.